Hello, I'm Dr. Michael Wright, the Chief Medical Officer for Avant. I'm joined today by Ruanne Brell, Senior Legal Advisor. Hi, Ruanne.
Hi, Michael.
Medicare and the rules and requirements associated with it can be complex. And in this series, we're looking at some of the top questions our Avant members have asked us about Medicare and what you need to know. In this episode, we're going to talk about referrals. So the first question is whether a specialist can see a patient without a referral.
So the simple answer to that question is yes, Michael, the specialist can see the patient without a valid referral, but they won't be able to access the Medicare benefit for that consultation. This is because the intention is that the patient's treating health practitioner should have had the consultation with the patient to determine that the need for the specialist to be involved is in fact relevant for that patient's treatment. And that should happen before the specialist is engaged. There are a couple of exceptions. Emergencies are one exception. And the other exception is where an anaesthetist might be undertaking the pre-anaesthetic consultation.
So what I'm hearing is if a patient can attend a specialist without a referral, they just can't bill Medicare for that appointment.
Correct.
Okay, that's great. What about if the patient's already seen the specialist and the patient thought they had a referral? Can they call me as the patient's GP afterwards and ask me to give them a referral?
You can't backdate a referral to a date after the patient has seen the specialist. The referral really should be issued before the consultation, even if it is on the same day. Backdating a referral is effectively fraud, and the Health Insurance Act makes that an offence. So we would be recommending practitioners do not do that if the patient has already seen the specialist.
I often have patients who misplace the referral or get there and can't find it and they don't have it. So what can we do in that situation?
Yeah, so that situation's a little bit different because you have already issued the referral. The patient just can't lay their hands on it at the time. And obviously, we would hope that there would be a copy of that referral in your medical records, and then it would be easy for that to be sent over to the specialist. From the specialist point of view, if the referral has been lost, stolen, or destroyed, the specialist can note lost referral for the initial attendance and the Medicare benefit can still be claimed. But a replacement referral or letter will be required for them to keep billing Medicare for that patient. Also, if it's an emergency situation, the word emergency must be made clear and included on the claim when the specialist makes that claim. In either case, only one referred consultation can be rendered before a formal referral is provided.
So, Ruanne, how long does a GP referral last for?
So, Michael, if the referral comes from a specialist GP to another specialist, then that referral is valid for 12 months, and that time starts when the patient is first seen under that referral. If it's from a non-GP specialist, then that referral is only valid for 3 months, and again, that starts from the time the patient is first seen. There are also circumstances where a GP can issue an indefinite referral, but that'll depend on the circumstances of the patient's condition as to whether that's appropriate.
Thanks for clarifying. I know we've also talked about named referrals in another vodcast episode where we were talking about public hospital billing. So that might be of interest to some of our viewers. But thanks for your time today, and thanks for joining us. And remember to look for other episodes in our series on Medicare billing and compliance. Thanks, everyone.